Namaste everyone. I am Neha Gupta, student of MBBS first year, SBMC Hazaribagh.
So today we are going to understand what diabetes is from the biochemistry point of view. Diabetes mellitus is a group of metabolic disorders that is characterized by high blood glucose level or high blood sugar level. Normally the range is from 70 to 110 milligram per deciliter in fasting state, but after breakfast or after having food, that is the postprandial state, the normal blood glucose level is from 126 to 200 milligram per deciliter. So if the blood glucose level in the test comes out to be more than this, then that is a sign for diabetes. So what is the root cause of diabetes? It is relative or absolute insulin deficiency. What is insulin? Insulin is a hormone which is anti-diabetic and it is secreted from the beta cells of pancreas. This hormone is anti-diabetic as it helps to maintain the blood glucose level. So it has following actions, like it increases the uptake of glucose by the peripheral tissues. Secondly, it increases the glucose utilization. It is anti-lipolytic hormone, that is, it prevents gluconeogenesis. So insulin is hypoglycemic hormone and it helps in it promotes glycolysis, it promotes glycogen synthesis, and it inhibits glycogenolysis and gluconeogenesis. Therefore, the blood glucose level is kept to its normal level. So the diabetes mellitus has been categorized into two types, the type 1 and type 2 diabetes. So the type 1 diabetes mellitus is insulin dependent diabetes mellitus because in this case the insulin production by the beta cells is zero due to the destruction of beta cells of islets of Langerhans of pancreas. Now, since there is no synthesis of insulin, the glucose level, the blood glucose level is not being able to maintain in the normal level, due to which it leads to diabetes. And it can occur in any age of life. Generally it is seen before 40 years of age, and it doesn't lead to obesity, and it may lead to ketosis or acidosis. The second is the type 2 diabetes mellitus, which is 90% of the total diabetic patients. In this case, there is decreased biological response of the cells towards the insulin. That is, the term used is insulin resistance. In this case, the insulin is produced. In this case, the body is unable to use insulin, and it occurs generally after 40 years of age, and this is also associated with obesity, ketosis and acidosis. Now, the type 1 diabetes mellitus can be treated with insulin injections, and the type 2 diabetes mellitus by the oral hypoglycemic drugs. Have you ever wondered why insulin injections are given and why not the insulin is given orally? This is because insulin is made up of amino acids. It's a protein hormone, and when it is taken orally, when it goes to the digestive tract, there it is degraded by the enzymes and therefore cannot be used. But when it is given intravenously by the injection, so it does its action. So let's talk about some of the signs and symptoms of diabetes mellitus. So the first one is glucosuria, that is the presence of glucose in urine. It occurs whenever there is the threshold for glucose level in urine is more than that which should be there. Like it is 180 milligram per deciliter. Whenever this threshold level is crossed, the glucose starts appearing in urine, and this case is known as glucosuria. Now, the second is osmotic diuresis. How it happens? Whenever glucose is excreted in urine, there is also the reabsorption of water by the renal tubules, and there is more excretion of water. This leads to polydipsia, because since there is more excretion of water, it activates the thirst center of our body, and that makes us thirsty and allow us to drink more and more water, which is known as polydipsia. Also, there is a symptom called polyphasia, that is, since the glucose is not being utilized by the body properly, so there is more intake of food for the as per the requirement of the cells of the body. Now, since glucose cannot be utilized by the body cells, therefore more number of fat is broken down for energy requirement, and this leads to formation of ketone bodies, and this is known as diabetic ketoacidosis, in which there is formation of ketone bodies, and this makes the medium more acidic and therefore acidosis. Now, how diabetes mellitus can be prevented, right? So the first line for its treatment, for its prevention, is a good balanced diet with good exercise. That is, diabetes is considered to be a lifestyle disease. If we bring modifications in our lifestyle, we are going to prevent this disease. Keep a healthy body weight, control your meal and reduce the portion, and be more physically active.